The U.S. spends over $4 trillion a year on healthcare, nearly half of the entire world's spend on healthcare services. That's about 18% of its GDP, in comparison to 10 to 12% in other developed nations. Not only is the U.S. the most expensive healthcare system in the world, it is also by far the most complex. Globally, there are 4 types of health insurance models. 1. The National Health Service model used in some European countries like the UK, where the government acts as the single payer through a central publicly owned national health service that delivers care. 2. The National Health Insurance model in countries like Canada and Taiwan, which involves publicly run universal insurance programs that every citizen pays into through taxes, but providers are privately run. 3. The Social Health Insurance model in countries like Japan and Switzerland, which are decentralized insurance programs where employers and employees finance sickness funds through payroll deductions, and privately run provider systems are paid to deliver care. And finally, the out-of-pocket model, most common in less developed countries, where patients pay for healthcare services fully out of pocket, though wealthier patients may buy commercially offered plans to help cover their healthcare costs. The U.S. is unique in that it has a payer ecosystem that involves all 4 models. First, the U.S. Veterans Health Administration, or the VHA, which delivers care to veterans, most closely resembles the National Health Service model. Then there's Medicare, a public program where the federal government acts as a single payer, insuring older Americans in a model akin to a national health insurance. Most Americans receive coverage through their employer in the social health insurance model, while uninsured Americans follow the out-of-pocket model, as they're on the hook to pay their medical expenses. This complex mishmash that makes up the U.S. health insurance ecosystem has evolved drastically over the past century. From original insurance that covered only major problems like getting a surgery, to insurance that covers doctor visits and preventative care. 2 watershed moments in the evolution of the U.S. healthcare system came from major policy changes: the introduction of the Medicare and Medicaid government insurance programs in 1965, and most recently, the Affordable Care Act, or the ACA reform, in 2010. Medicare and Medicaid, which insures the elderly and low-income individuals respectively, transformed the U.S. healthcare system by significantly expanding healthcare coverage to millions of Americans. Today, Medicare and Medicaid cover more than 100 million people in the U.S. The ACA further overhauled health insurance in a number of ways. It expanded government coverage to more low-income people who did not have access to affordable care. ACA also created a health insurance marketplace where individuals and small employers can purchase individual insurance. And there have been significant changes to the ACA since it was introduced, but it still has a big influence on the U.S. health insurance market. Over the years, the U.S. health insurance ecosystem has also evolved into the most expensive and fragmented insurance market in the world, with many different types of public and private payers and complex processes and contracts with numerous stakeholders. This primer will break down the U.S. healthcare payer ecosystem and explain the key characteristics of a U.S. health insurance plan, the different types of health insurance programs in the U.S., how insurance companies work with the government, providers, employers, and other key institutions to deliver healthcare coverage, and how healthcare service reimbursement works. Let's dive in.